Hello everyone, I am Dr. Imreen from Meerut and I have come to 2 days hands-on training under the guidance of Dr. Pankaj Talwar sir, and today I'll talk about the medias. How do we process the semen? So first, there are 3 types of medias. One is the HTF medias, human tubal fluid media, and the second is single density gradient media, and third is double density gradient media. In double density gradient media, we use 2 type of combinations. One is 90 and 45 and the other is 80 and 40.
So 80 40.
This is 90 and 45.
Yes.
And the other is 80 and 40. So the media comes into, it can come into a glass vial and it can come into a plastic container. And then how do we process the semen? So the first is swim up. So in swim up we use HTF media and we take the semen sample about 1 to 2 ml and then we put in a test tube. This is the test tube, conical test tube, and then we put the media and then we centrifuge for about 15 minutes at the rate of 1200 rpm, and then after that we give 2 things. One is pellet, which is at the bottom of the test tube, and the other is supernatant, which is above the pellet. So we have to discard the supernatant. We are using 2 test tubes. The first we have, in the first test tube we have to discard the supernatant, and then we have to pick up the pellet and we use the second test tube. In the second one, what we do, we use the semen wash media, and then we go up to the swim up technique. And what is swim up? We have to put that test tube into a test tube warmer and then we have to tilt it at 45 degrees for 20 minutes. The sperm will swim up. So the supernatant part, the part on the surface, we have to collect that, and that is the post-wash sperm semen sample for the IUI. And then the second...
I have one question. I am Dr. Kalpana from Maharashtra. How much semen sample to be taken, ma'am?
1 to 2 ml.
And that media?
Media is same, 1 to 2 ml.
1 ml semen, 1 ml semen. Equal.
Yes.
Wash media. Wash media.
No, for HTF.
HTF media in the first tube.
First
and in
tube.
the second tube.
Second tube we can take 1 ml of the wash media. Wash media.
1 ml of wash
Wash
media,
media.
and the 1 ml of semen sample.
No, that pellet. Pellet.
Once your pellet is formed.
Yes, after that.
After.
Once the pellet is formed, we have to, that is known as resuspension of the pellet. We have to take the pellet with the pipette in a new tube.
We will just take the pellet with the pipette, or we will add some solution.
Little 0.5 ml of the wash media, and then we have to dissolve, and then we have to take it into a new tube, and then we have to go for the swim up technique.
For that, how much will you add? That's
1 ml.
That is 1 ml.
1 ml. And then, yes?
That pellet you will add 1 ml.
1 ml.
Wash
Yes.
And is there criteria, ma'am, any for pre-wash and post-wash?
Dr. Imreen, there is some
Yes.
confusion. After the pellet is formed, what next step you are going to
Yes,
do?
is transferring it to the...
No, this process is known as resuspension. What we have to do, first we have to discard the supernatant. We have to take the pellet, you have to dissolve the pellet with the 0.5 ml of wash media
In the same tube.
in the
after
same
discarding
tube.
the supernatant?
And then we have to take that pellet into a new tube. Okay, and then we have to add the wash media and we have to go for the swim up technique.
We are confused. Do
Okay.
we need to centrifuge once or twice?
Once, and
that
the
is
second time we have to go for the swim up. We don't have to centrifuge that. We have to keep the test tube at an angle of 45 degree in a heating chamber, and we have to leave it for 20 minutes. And after 20 minutes the sperm will come up on the surface, and we have to take that part for the processing of the semen and for the
for IUI.
for IUI.
Video, there are 2 different